Today, MPs are expected to approve the move, which the Prime Minister says will help fund the NHS and social care. Well, one of the main problems is that we have a massive staffing shortage. And despite more of all our pay packets heading into the system, there is no guaranteed pay rise for care home workers to encourage more to train up. Anthony Heppell is a manager at a home in Lincoln for young people with complex needs.
We are paying our staff more than the average across the sector to try and entice them in. But I think there's a lot of PR needs done in social care because everything's driven towards elderly care. All the policies, procedures, everything's towards elderly care, whereas learning disability is completely different.
Earlier in the week, we spoke to Paul de Savary. He's managing director of Home From Care, who run 11 care homes for young adults with learning disabilities and complex special needs across Greater Lincolnshire. He outlined what he'd like to see. So I caught up with him again earlier today to get reaction to what's been announced.
Well, I think kind of the good news is that after 20 years, the government's made a decision, which is fantastic. Unfortunately, or however, the political expediency of packaging social care as part of NHS focus, which is sort of understandable, but it does mean that the NHS will consume most of the funds. But at least it's the start of a process. So I don't want to be sounding sort of mean towards them because they have started a process and now it's on the radar. The bad news is that it offers no immediate help for the critical funding, the critical staffing situation, and that which is exacerbated by vaccine refusal and the serious image problems that the sector's got, caused by underfunding. So, I mean, we've noticed the despair amongst other providers is shocking. You've got demoralised management teams who feel abandoned by government ministers' repeated failure to comprehend the magnitude of the now issues and act with agility. All this other stuff sort of long term. It's about now, So with no firm promise of new funding, for social care, even years down the line, this doesn't bode well.
And the Prime Minister has revealed £36 billion tax bid to fix the NHS and social care, but we understand care initially will get a fraction of that at just £3 billion. I mean, is that a drop in the ocean, Paul, when it comes to what needs to be done?
Well, it is a drop in the ocean in the context of the now situation. It depends how it's spent and all those sort of caveats around that. But the issue is about now, and there's nothing about now. Right at this moment in time, staffing, recruitment is in a crisis situation, and there is no sort of understanding of that. From our side, Home From Home Care, we're affected by tight staffing, but we have to work really hard to try and fight against the negative perceptions of care. We ensure that the people working for us are well paid. We ensure great opportunities, progression. We've got a supportive team in place for employee well-being. But that's only possible because we operate a unique data-driven care system, which is totally unique. So I do really, really worry about how other organisations in our sector will manage, without immediate government support.
And also you mentioned the staffing, of course, that they're saying it will be cheaper to get care for families. They'll be capped at £86,000 a year. But if you haven't got the staff in place to look after those people who require care, it doesn't matter, does it?
Well, that's the whole point, isn't it? I mean, right at this moment in time, the staff are not there, and that's a reflection of the image, and even we ourselves, we were ready to launch new services. We were going to recruit another 250 staff. Well, there's not a hope in anything being able to do that right at this moment in time. So, it's a really great pity. But the problem government will always face is that it's got to look at the strategic political situation. But what it fails to do in every situation is really be responsive to the immediate situation. Because the problem is, I don't even think that the Department of Health and Social Care actually understand what the immediate situation is. They spend their time consulting, but I'm not sure that they actually really understand what the immediate situation is. Because surely if they did, they would do something about it.
And of course, we need to see investment in social care, but there is criticism as well in this tax hike, the tax burden, the highest in history, and people being made to pay more national insurance. It affects the lowest paid, and of course that includes care workers, doesn't it?
Well, that's the irony of the situation. The people at the lower end of the scale are going to still have to pay. I'm not going to debate whether they should or shouldn't, but my view is, felt personally that if somebody's is least able to afford to pay something, well, even if you charge them for it now, I mean, you could compensate it by raising thresholds and so on, which would actually take them out of that. And I guess that's what will start to evolve as we go forward. But it is ironic that care workers who are so poorly sort of treated in many respects, and they shouldn't be, and where there are not enough, and now we're actually saying, well, you're going to get hit for another, I don't know, what is it, £250 worth of tax a year.
Moving forward, what will you be looking for now, Paul?
Oh, gosh, what we'll be looking for? I mean, it really is to engage. I think all we can do at the moment is to say, all these strategies, fine, they'll work their way through. We have an immediate problem in the sector. There are not enough staff as it is. So the idea that you're going to expand the sector or do anything, that's almost down the line. We need an immediate intelligent viewing of what the issues actually are. For example, if vaccination and the requirement by the 16th of September is going to take 40 to 50,000 people out of social care, well, and already there's a shortage, which is arguably 100,000 people. It's hard to actually work out what the stats are because there are so many numbers around. Well, then surely what you should do is say, well, actually, maybe we're going to delay the vaccination just by 6 months. Or alternatively, we are going to allow some more people into the country, limited number, for a period of time to solve this problem. But the idea that people coming off furlough and all of this is going to fill all of these roles, I mean, that will take time for it to happen. We don't have time.
Paul de Savary there, Managing Director of Home from Home Care, runs 11 care homes for young adults across Greater Lincolnshire, with his thoughts on what's been announced.